Clinical examination of the central nervous system. Cranial nerve 7. So the seventh cranial nerve is the facial nerve, and it supplies the muscles of facial expression. It runs a complicated anatomical course accompanied initially by the sensory fibers subserving taste. Weakness of half the face may occur as a result of a lesion of the facial nerve. It may also result from a motor neuron, as pyramidal lesion above the seventh cranial nerve nucleus. Now let's look at the cause of the facial nerve. Facial nerve arises from its nucleus lateral to the nucleus of the sixth nerve wings around the sixth nerve nucleus, and emerges from the front of the pons medial to the vestibulocochlear nerve, and it passes laterally through the petrous bone in the internal auditory meatus. In the middle ear, it turns sharply posteriorly at the geniculate ganglion to run back along the medial wall of the middle ear, and then vertically downwards through the facial canal. So in its bony course, the facial nerve is vulnerable to basal skull fracture and edema, and it emerges from the facial cranial canal. So it emerges from the facial canal at the stylomastoid foramen anterior to the mastoid process, and it spreads out within the parotid gland to supply all the facial muscles of the face, neck, and scalp, apart from the levator palpebrae superioris. So the terminal branches of the facial nerve are temporal, zygomatic, buccal, mandibular, and cervical. So you can use this mnemonic as you tell Ziggy Bob Marley code. Tell Ziggy Bob Marley code. You tell for temporal, Ziggy for zygomatic, Bob for buccal, Marley for mandibular, code for cervical. So that's the terminal branches of the facial nerve. To test for the facial nerve, you ask the patient to frown his forehead and observe any asymmetry. So you note the contraction of the frontalis muscle. So a patient will be able to frown the normal side. If a patient is able to frown the normal side but not able to frown the affected side, then the weakness affects both the upper and the lower segments of the face. In upper motor neuron lesion of the facial nerve, the patient will be able to frown both sides of the forehead. It is because each nucleus of the facial nerve innervates the muscles on both sides of the forehead. So if one nucleus is affected, the other can still function and also frown the forehead. As emotional movements such as smiling and yawning may be spared with cortical lesion. So next, you let the patient close his eyes very tightly, and you try to open his eyes with the two thumbs, and noting the strength of the orbicularis muscles. Also note if the eyelashes are buried symmetrically. And then you let the patient bare his teeth or gums in a big grin, and to puff out his cheeks and feel for the strength of the buccinator muscles. Alternatively, you can ask him to whistle and observe him